Hello, good morning. I am Dr. Rohit from the Department of Oral Pathology. Today we will be going to discuss about the definition and classification of dental caries. Caries is a word derived from the rot or a decay. It is an irreversible microbial disease of the calcified tissues of the teeth characterized by demineralization of inorganic portion and destruction of organic substance of the tooth, which leads to the cavitation. Now, coming to the classification of dental caries. Dental caries is classified as according to the location of individual tooth, according to the rapidity of progress and appearance on the tooth surface. So first, according to the location of individual tooth, it is classified as pit and fissure caries, smooth surface caries, and root surface caries. Then, according to the rapidity of progress, it is classified as acute dental caries and chronic dental caries. And according to the appearance on the tooth surface, it is called as primary caries, that is also called as virgin caries, and secondary is recurrent caries. So this is about the classification of the dental caries. Coming to the first, that is pit and fissure caries. It is located primarily on the occlusal surface of buccal and lingual grooves of posterior teeth. See this picture shows the color and appearance of the pit and fissure caries. They appear brownish to blackish in color and are soft and catchy with the explorer instrument. They develop in the poor cleansing area where the cleaning by toothbrush is also not possible. So that's why the food lodgement is there and the pit and fissure caries develops. The cross appearance of pit and fissure lesion are inverted V with a narrow entrance at the enamel level and progressively they spread inside the dentin towards the dentin, that is called as DEJ. So narrow at the enamel level or at the start and they spread towards the DEJ and having a wider surface area. Then next is smooth surface caries, also called as proximal caries, which develops on the proximal surface of the teeth and gingival third of buccal and lingual surfaces of the molars. Occurs just below the contact point of the tooth. Suppose these are the two molars and this is the contact point of the molar. So that they develop in this area at the contact point of the tooth. That is called as cervical area. They are preceded by the formation of microbial or a dental plaque just below the contact point. So earlier they are faint white in color, that is called as chalky spots develop near the contact point of the tooth. Then slightly rough, then it becomes slightly rough and surrounded by enamel which is bluish white in color. Next is linear enamel caries, that is called as odontoclasia, seen in the neonatal line area of the anterior teeth. Coming to the root surface caries as it is seen in the this picture, it is blackish in color, soft progressive lesion on the root surface. It occurs on the root surface and generally occurs in the older age group. Also called as caries of the cementum, found on the buccal and lingual surface of the tooth. Coming to the next classification, according to the rapidity of the process or progress of the caries, it is classified as acute and chronic. So coming to the acute is a rapidly spreading with the pain and symptoms. Generally occurs in the young and children, as their dentinal tubules are large and open. So the caries can be spread easily. So rampant caries, it is one of the form of the acute dental caries. It is defined as sudden, rapid, and almost uncontrollable destruction of the tooth, includes the proximal and cervical surface of the mandibular incisors and maxillary also. Every time when you visit the dentist, a dentist can easily point out that the previous caries lesions were increased as compared to the previous visit. So every time you can observe that increment of more than 10% of the new caries lesion will be seen. That's why they are called as rapidly spreading. Etiological factors are dietary factors and oral flora. It is said that sudden change in the dietary factors or oral flora of the person will lead to the formation of the rampant caries. So these multiple carious lesions which are rapidly spreading are described here. Next is chronic caries. These lesions are usually of long-standing lesion with less symptoms or no pain. So pain is not a common feature, and it will look dark brown and leathery consistency. Nursing bottle caries. Nursing bottle caries is a form of chronic caries, or also called as baby bottle syndrome, seen in infant and toddlers where there is long-standing or improper bottle feeding habits and longer use of pacifiers or honey dipped in the this honey pacifier dipped in honey. In this case, maxillary dentition is affected, and mandibular incisors of the children or teenagers are spared because of the cleansing action of the tongue. Next is arrested caries. Arrested caries are the caries which become stationary or static and does not show any tendency for further progression. It is because of good tissue resistance, the spread of caries is stopped. Generally seen in the younger individuals where the immunity of the body is good. So it appears as a marked brown pigmentation and induration of the lesion, also called as hibernation of the dentin. This is arrested caries where hibernation of the dentin is seen in as a brownish lesion. Generally, most of the time seen in the occlusal or proximal surfaces of the tooth. And next is primary caries, also called as initial caries. Primary caries is one in which the lesion constitutes the initial attack on the tooth surface, like where it initially developed, either on the proximal surface or on the occlusal surface. So according to that, it is classified as primary caries. And secondary caries, also called as recurrent caries, observed around the edges and undermined restorations or faulty restoration. The common locations of the secondary caries are rough or overhanging margins and fracture places in all the locations of the mouth where the restorations are faulty. It may be result of poor adaptation of the restoration also, which allows marginal leakage. Thank you. It was all about dental caries and its classification.